Some of the symptoms of dementia include repeating a question over and over again, having difficulty spelling the words that are commonly used in the day, and losing control of one's behavior and emotions that are slowly taking over one's life. They also destroy the lives of those around the patient. Alzheimer's disease is the most common cause of dementia in people 65 and older. According to the Alzheimer's Association, more than 3.5 million Americans suffer from this disease. One person gets Alzheimer's every 70 seconds. While Alzheimer's or other forms of dementia are thought to be the inevitable side effects of aging, some research suggests that dietary considerations may help protect the body against dementia and even prevent debilitating brain diseases. Because dementia is associated with long-term inflammation, foods that have long-term anti-inflammatory effects may delay the effects of aging. Before we continue with the list, make sure to subscribe to Healthy Lab and turn on the notification bell to help us grow. Every subscriber is much appreciated. So, let's start. 10. Dark chocolate. Researchers have shown that the flavonoids in cocoa increase blood flow to the brain and may protect the body against conditions that reduce blood flow to the brain such as dementia and stroke. To gain the most out of it, buy low sugar, high cocoa chocolate. However, although cocoa is rich in beneficial compounds, it is high in saturated fat and is often used in combination with high-fat ingredients such as sour cream, so the best way is to use dark chocolate. In addition to chocolate, flavonoids are found in almost all fruits, spices, veggies, and herbs. 9. Omega-3. Studies show that people who ate an average of 3 servings of oily fish a week were about 48% less likely to develop Alzheimer's and dementia. These people had significantly higher levels of omega-3 fatty acids in their blood. Salmon, a fatty fish, which is a great source of omega-3 essential fatty acids and other essential nutrients like vitamin D and vitamin B12, helps prevent some disorders. Eating at least 2 or 3 servings of oily fish a week helps provide anti-inflammatory compounds. Walnuts, flaxseed, and dark leafy vegetables are rich sources of omega-3 plants and acids. They are alpha-linolenic, but they are deficient in eicosapentaenoic acid and docosahexaenoic acid, the 2 major omega-3s. Although alpha-linolenic is automatically converted to eicosapentaenoic acid and docosahexaenoic acid by the body, it is actually very slow, approximately 1 to 2%. If your omega-6 absorption is high, it will be greatly reduced, so relying solely on walnuts, flaxseed, and dark leafy vegetables may not provide enough omega-3 fatty acids. It is best to eat fatty fish that are good sources of omega-3 fatty acids. 8. Turmeric. Plaques that accumulate in the brain appear to help spread the decline of brain cells and lead to Alzheimer's disease. A study proved that curcumin in turmeric is an effective substance that kills brain plaques. Turmeric has long been used as an excellent anti-inflammatory food. It is mainly used as a condiment and spice in foods. Dementia has been reported less frequently in countries that use turmeric spices on a regular basis. Add this cheap and abundant spice to your food at least once a week to reduce inflammation and dementia. Ginger, like turmeric, has similar anti-inflammatory properties. Although research on the effect of ginger on brain activity is limited, ginger's ability to reduce inflammation may indirectly have some anti-dementia effects. 7. Apple. Research has shown that quercetin, which is abundant in apple peel, protects the brain against damage linked with Alzheimer's disease and other mental and neurological disorders. Other studies have shown that eating apples may help reduce the risk of cancer. 6. Walnut. Research on aging has shown that a balanced diet containing walnuts helps improve practical and mental skills in older people. Experts believe that the combination of polyphenols, omega-3 fatty acids, and other bioactive substances in walnuts is responsible for this beneficial effect. Still, overconsumption of it is not necessarily good. This is due to the high omega-6 content in walnuts. Although walnuts are high in alpha-linolenic acid, they are high in linoleic acid, an essential omega-6 fatty acid. Linoleic acid can cause the body to produce more inflammatory compounds and produce less omega-3 anti-inflammatory fatty acids. This is when the omega-6 to omega-3 ratio is out of balance. Although the exact mechanism of action of walnuts in promoting mental function is unknown, most doctors and nutritionists recommend eating them, so do not hesitate to eat the right number of walnuts. Enjoy a handful of mixed nuts as a snack, dried fruits, and nuts such as hazelnuts, walnuts, and pistachios every day to get a range of health-promoting nutrients every day. 5. Green tea. Green tea is an extremely rich source of a flavonoid called catechin. Many studies have found the health benefits of green tea, including its ability to reduce the risk of cancer and reversible neurological diseases. The ability of green tea to maintain and control weight has also made it a popular choice in many health-promoting diets. In a study in 2018, scientists looked at the tea and coffee drinking habits of people who are older than 65. The individuals were grouped by how often they drank green tea, not at all, 1 to 6 days a week, or every day. The outcomes demonstrated that drinking green tea 1 to 6 days per week or every day was connected to less cognitive decline and dementia. People who didn't consume it at all, on the other hand, achieved slightly lower on a consideration and memory test. 4. Asparagus. Research has shown that people with folate deficiency are 3.5 times more likely to develop dementia. Use asparagus as an alternate additive in your diet to make sure you get enough folate, as 1 cup of asparagus provides some of your daily folate needs. Other excellent sources of folate include citrus fruits, legumes, broccoli, cauliflower, beets, lentils, and leafy green vegetables such as spinach and turnip leaves. 3. Cherries. Nutritionists and scientists have found that the antioxidant compounds and anthocyanins that give cherries a clear red color have anti-inflammatory properties but do not have any possible side effects. Non-steroidal anti-inflammatory drugs can have side effects, some of which include bleeding from a heart attack. Still, cherries do not irritate the stomach as industrial drugs do and contain compounds that stick together. Cherries are also effective in platelet production and function. Cherries and fruits like the berry family, such as raspberries and strawberries, all contain antioxidants and anti-inflammatory substances that help reduce inflammation and oxidative stress in the brain. Inflammation of the brain and its oxidative stress are both associated with dementia and Alzheimer's. 2. Vitamin B12 foods. Vitamin B12 helps support the body's nerve function, and its deficiency can cause a variety of symptoms, including memory loss. However, taking vitamin B12 in its absence may not increase memory in Alzheimer's patients. Intake foods rich in vitamin B12 such as meat, fish, poultry, eggs, milk, cheese, dried beans, avocados, whole grains, and soy milk. Some investigations indicate low vitamin B12 levels may be linked with a raised risk of dementia. Regardless of its function in memory, vitamin B12 stays an essential part of a healthy and balanced diet. Vitamin B12 is found naturally in foods that come from animals like fish, meat, and poultry. Numerous breakfast cereals are fortified with vitamin B12. 1. Coconut oil. Coconut oil can help prevent Alzheimer's and other brain problems. Coconut oil reduces the effects of ampules on cortical neurons, according to a 2014 study published in the Journal of Alzheimer's Disease. The peptide is one of the components of this disease. In addition, triglycerides in coconut oil help restore nerve lining and improve cognitive function. Use cold, pure coconut oil for overall brain health. To prevent Alzheimer's, take 1 to 2 teaspoons of organic, cold, and pressed oil twice a day regularly. Even if you do not follow the diet of the mind carefully, researchers emphasize that following a part of this diet can effectively reduce the chances of developing dementias. This diet recommends that you include leafy green vegetables, nuts, berries, fish, poultry, olive oil, and other vegetables and fruits. Eat red meat in moderation, cheese, and sweets. Limit fried foods, fast food, butter, and margarine. In this video, we try to answer questions such as what to eat to treat Alzheimer's or what to eat to treat dementia and point out the harmful and beneficial foods for Alzheimer's. In addition to nutrition, what do you think causes Alzheimer's? As always, you can share your opinion with us in the comments section below. Thank you for watching, and we look forward to seeing you in the next video.